Right over there, you have another sign that is exit. Please push the door, make a left turn, and then come across to the water fountain where the assembly point is. For some of you who were here last night and had a good time up in the Aura Lounge, they had asked me yesterday if they can open today and until Saturday. Usually it's closed, we're gonna open, so after you finish your day, you can go and have a drink, view the city from there and have a great time. As I said, we usually it's closed, but we're gonna open for all of you. Have a great conference, thank you.
Thank you very much, Mr. Montenegro. The Honorable Philip A. Telesford, Minister for Health of Grenada, joining us virtually. Dr. Armstrong Alexis, Deputy Secretary General of the CARICOM Secretariat. Ms. Alison Drayton, Assistant Secretary General, Human and Social Development of the CARICOM Secretariat. Dr. Lisa Indar, Executive Director of CARPHA. Dr. Horace Cox, Acting Director, Surveillance, Disease Prevention and Control, Innovating. Representatives of international development partners, including those joining us in person from the Inter-American Development Bank, Pan-American Health Organization, UK Health Security Agency, Centers for Disease Control and Prevention, Cornell University, and those joining virtually from the World Bank, Public Health Agency of Canada, French Development Agency, Dutch National Institute for Public Health and the Environment, United Nations Environment Programme, ARS Martinique, SC Comisca. Heads and representatives from Caribbean regional agencies, including those joining in person from the Caribbean Community Secretariat, Regional Security System, Caribbean Agricultural Health and Food Safety Agency, Caribbean Disaster Emergency Management Agency, Implementation Agency for Crime and Security, Caribbean Development Bank, and those joining virtually from the OECS Commission. Permanent Secretaries, Chief Medical Officers, Policy and Planning Specialists of 24 of CARPHA's 26 member states, Department Management and Area Leads of CARPHA joining in person and virtually, members of the Regional Health Security Network, other CARPHA staff, members of the media, ladies and gentlemen, it is my great pleasure again to welcome you all to this beautiful city of Georgetown in Guyana for the official launch of the Caribbean Public Health Agency's strategic plan for the years 2025 to 2030. We are honored to host this important regional event here in Guyana, a country rich in diversity, resilience, and deep commitment to public health. On behalf of the executive management of CARPHA, I extend heartfelt thanks to the government and counterparts at the Ministry of Health for their gracious hospitality and strong support to make this launch possible. Today marks a significant milestone in our health journey for the region. Under the theme, Stronger Together, Advancing Caribbean Health Through Collaboration, Innovation, and Sustainable Action, this strategic plan reflects CARPHA's collective vision up to the year 2030 to align with the SDGs and the CARICOM Secretariat's strategic plan, and is rooted in regional solidarity, scientific excellence, and a shared responsibility for safeguarding the health of every Caribbean citizen. It is the hope of CARPHA that upon completion of these 2 days of launch activities, that we will have a clear picture of what member states see as priorities in the work that we have planned for the 6 years period, and that regional partners would identify areas where we can further collaborate and pool resources to better serve our member states. We also hope that our development partners will be able to identify areas of alignment with their regional strategies so that we can explore areas of possible support, financial or otherwise. Without further ado, I would like to invite Dr. Lisa Indar, our Executive Director here at CARPHA, to bring welcome remarks. Over to you, Dr. Indar. Please welcome her.
Honorable Minister Philip Tallisford, the Minister of Health Grenada, and the Chair of CARPHA's Executive Board, Dr. Armstrong Alexis, the Deputy Secretary General of the CARICOM Secretariat, Ms. Alison Drayton, Assistant Secretary General of the Directorate of Human and Social Development, CARICOM Secretariat, Rear Admiral Shillan from RSS, it's really good to have you here, and all the different CEOs and representatives of the different agencies that Dr. Sami called from our regional agencies, SEDIMA and IMPACTS and RSS, as well as our representatives, Ms. Peter Hutter, and representatives from PAHU, our representatives from UKHSA, from CDC, and others, the Public Health Agency of Canada, Agency Francis for Development, Organization of the Caribbean States, the Dutch Institute of Public Health and Environment, and many, many others. Dr. Mark Sami, Director of Corporate Service, Dr. Horace Cox, our incoming Director of Surveillance, Disease Prevention and Control in AD, or 2 times. Dr. Kavita Singh, our Senior Lead Specialist, Health, Nutrition and Population, Inter-American Development Bank. Our representatives, our permanent secretaries and their representatives, chief medical officers, national policy planning officers of 24 member states, as well as their representatives from our department management team, area leads, other CARPHA staff, members of the media, ladies and gentlemen, good morning. Gosh, let me say that again, good morning. It is a profound honor and privilege to welcome you to this landmark event, the official launch of CARPHA's 2025 to 2030 strategic plan. Under the inspiring theme, Stronger Together, Advancing Caribbean Health through Collaboration, Innovation, and Sustainable Action. Today marks not just the unveiling of a document, but the reaffirmation of a regional commitment, a collective promise to safeguard the health and well-being of every Caribbean citizen through unity, forward thinking, and sustained strategic action. This strategic plan was developed through a highly consultative and participatory process with input solicited from member states, our regional and international institutions, our international development partners, which all help to ensure that the strategic plan targets the current as well as the emerging public health needs and priorities of the CARPHA member states. And it will pave the way for improved collaboration and coordination with our institutions and IDPs. The 6 strategic priority areas from the last strategic plan have been retained, but key emerging threats to public health, as identified by our countries, such as antimicrobial resistance and crime and violence as a public health issue, have been integrated into the new plan. A major emphasis of the second CARPHA strategic plan follows the previous one from 2018 to 2022, is the focus on results buoyed by the call from CARPHA's Executive Board at their 20th meeting in 2020 for the adoption of a results-based management approach to our operations. We are walking the talk. This request was driven by an increasing demand for evidence of impact of the work that CARPHA is doing and of a transformative change at individual, institutional, and at country levels. This plan is therefore grounded in the 6 strategic priorities, which will be elaborated upon as we proceed over the next 2 days with the launch activities. These strategic priorities are aligned with key global and regional development frameworks, including the Sustainable Development Goals, the SDGs, the CARICOM Strategic Plan, CARPHA's Regional Integrated Surveillance Strategy, and the Caribbean Cooperation and Health, CCH. Indeed, Section 3 of the strategic plan, so we're assuming you have read the plan, articulates the contribution that CARPHA, through each strategic objective, is expected to make the achievement of health-related SDGs. The plan also includes a clear theory of the change which sets out how CARPHA will effect the desired changes across the life of the strategic plan and the assumptions which must hold true for the desired change to occur. Further, the plan includes a focus on results through the adoption of the results-based management approach for delivery of public health interventions. But before we look ahead, it is important that we pause to reflect. The last decade has been a defining and challenging one for global and regional public health. Yet, in the face of each challenge, one truth has stood firm. We are stronger together. We saw this during our COVID-19 response, where collaboration across borders, institutions, and disciplines enabled us to navigate an unprecedented crisis. We saw it through our efforts in the laboratory strengthening, integrated disease surveillance, early warning systems, tourism and health initiatives, health promotion, and environmental health interventions, including our communication messages. We saw it in our ability to secure vaccines, personal protective equipment, and technical support through trusted partnerships and a coordinated regional mechanism. So today is not just about launching a plan. It is about renewing our collective determination, not only to recover from the crisis of the past, but to build stronger, smarter, more resilient systems that can withstand the challenges of tomorrow. What can we expect from CARPHA based on this new strategic plan? Well, the following: improve delivery of technical interventions guided by the One Health approach, exploitation of its intimate knowledge of the Caribbean context to develop and deliver interventions that are tailored to the Caribbean context like no other entity has. Improve efficiency in uses of resources and delivery of value for money, particularly in the current climate where resources are being diverted to areas where they are most needed. Improve communication of results to demonstrate the value added by CARPHA through the difference in making the countries. And I'm sure you will agree that these new outcomes or these enhanced outcomes is going to better deliver products that will enhance our member states. The 2025-2030 strategic plan represents the accumulation of extensive consultation, evidence gathering, and further focused design. It is a living blueprint that outlines how CARPHA will continue to support our member states in improving population health, reducing health inequities, and strengthening regional health security. I want to acknowledge the CARPHA management, the DMT, the divisional management and technical teams, many of whom have worked diligently to bring this vision to life. I want to also thank the European Union for their continued support through the provision of funding for this important initiative. We truly appreciate your continued support in improving CARPHA's ability to efficiently serve our member states. This plan is bold in its ambition, but is also cognizant about the realities we face. We know that the region is operating in a complex fiscal and geopolitical environment. and health systems remain under strain. Resources are limited. Climate and economic vulnerabilities persist. This is why the plan is also a call to action for deeper, more strategic partnerships. From a resource mobilization perspective, the medium to long-term plan helps everyone gathered for these 2 days, including our IDPs, to better understand and appreciate the broad scope of the agency's program of work, including the resources required for its delivery. Through the big picture approach, we hope that you will be able to appreciate how the projects that you support, you as our partners for support, contribute to the results of the agency's 6-year program of work. The big picture approach to be achieved through the 6-year strategic plan will also provide partners with an opportunity to conduct a better assessment of the areas of convergence with their respective programs of work to better inform the decisions on those areas in CARPHA's strategic plan in which they would want to invest. Partnerships and multi-sectoral collaboration are the heart of this new strategic plan. In fact, partnerships and collaboration is one of the 6 guided principles of the strategic plan. And we just came out of a 2-day meeting with our wide range of partners and member states, encouraging and emphasizing the need for collaboration and partnership for regional health security. To our member states, we pledge to stand with you in building capacity. We pledge to deliver technical assistance and respond rapidly to emerging threats. But we will also need your leadership, your ownership, and your investment in this shared vision that the plan represents. An important component of this 2-day launch will be your feedback on the work that we have proposed over the 2025-2030 period, as well as the timing and areas of the co-financing where possible. We need your help to guide us better. To our regional agencies, our CARICOM institutions, we say our mandate are interconnected. Let us continue to align our work, avoid duplication, and amplify each other's impact. And to our international development partners, we thank you for your steadfast support. CARPHA cannot deliver its mandate without you. This new strategic cycle offers a clear opportunity to deepen our collaboration, harmonize efforts, and co-invest in regional public goods that benefits us all. As we look ahead to the next 5 years, I want to see this moment not just as a launch, but a new beginning. A beginning of renewed trust among our stakeholders, a beginning of smarter, more adaptive programs, a beginning of stronger integration between health and the development sector, and a beginning of a movement where every policymaker, every health worker, every partner and citizen plays a part in advancing Caribbean health. Let us not underestimate the power of collaboration, the potential of innovation, or the urgency of sustainable action. Because when we come together, when we share our knowledge, when we share our resources, our hopes, our dreams, we can overcome even the greatest challenges. We are indeed stronger together. Thank you very much. In closing, I want to thank you once again for being here today and for standing with CARPHA. We look forward to walking this journey with you side by side as we implement the strategic plan. Together, let us commit to building a future where all Caribbean people can live long, healthy, and fulfilling life. Thank you and welcome.
Thank you very much, Dr. Indar, for those inspiring welcome remarks. And Dr. Indar echoed, the sentiments over the last couple of days, stronger together. Not like the West Indies cricket team, but we, stronger. Sorry, I think I opened some beer wounds there. Sorry. And Dr. Indar also spoke about, feedback from member states, partners, and regional agencies, because we can plan something, but if it's not a priority for you, we need to hear from you. So during this launch, an important segment will be feedback from member states, regional partners, as well as IDPs on what are priorities for the region for the next 6 years. All right, on that note, I would like to invite the Honorable Philip A. Telesford, who's joining us virtually, to provide remarks. And as Dr. Indar mentioned, Minister Telesford is the Minister of Health for Grenada, and he's also the chairman of CARPHA's executive board, and also will be the chairman of the Council of Human and Social Development for this period. Over to you, Minister. Thank you.
Thank you, Chairman. I salute and greet our honorable ministers who are here with us this morning, our chief medical officers, permanent secretaries throughout the region, policy planners, regional agencies like CCS, OECS, CDEMA, IMPAS, RSS, UWI, CCCCC, etc. IDPs like the European Union, World Bank, PAHO, CDC, IDB, UK, HSA, CDB, AFD, and PAC, our MOU partners, Cornell University, Comisca, OAS, University Hospital, Martinique. I also salute and recognize Dr. Lisa Inda, the Executive Director of CARPHA, other specially invited guests, distinguished colleagues, officials from CARPHA, partners and friends of the Caribbean Public Health. Good morning, and what a momentous morning indeed it is. It is bright and sunny here in Grenada with a little sprinkle of rain, but it is really beautiful here, and I'm sure the same story is borne out throughout the rest of the Caribbean region. Today, we do more than the launch of a strategic plan. We reaffirm a shared vision. We renew our collective promise, and we reignite the spirit of regional unity that has always been the heartbeat of our Caribbean resilience. As chairman of CARPHA Executive Board, I'm deeply honored to be with you at this pivotal juncture. The unveiling of CARPHA 2025-2030 strategic plan is not just a technical milestone. It is a bold declaration of political will, of leadership in action, and of our unwavering commitment to safeguarding the health and well-being of every Caribbean citizen. This plan is a product of tireless collaboration, rigorous consultation, and above all, the steadfast leadership of our member states. It reflects the wisdom of our ministers of health, the foresight of our technical teams, and the courage of our communities. It is a living document shared by our past, grounded in our present, and designed to meet the future head-on. Let me be clear. Political commitment is not just about words on paper. It is about showing up. It is about investing in systems, empowering institutions, and standing shoulder to shoulder when the wind blows hardest. And yes, it did. Just weeks ago, the anniversary of Hurricane Beryl reminded us yet again of the fragility of a region in the face of climate change disasters. Homes were lost. Lives were lost. Lives were also disrupted. But amidst the chaos, we saw something powerful. Coordinated responses, rapid mobilization, and a region that refused to be broken in the face of natural disaster. And who can forget the crucible of COVID-19 when the world was gripped by uncertainty? CARPHA stood as a pillar of hope and stability. From early testing and surveillance to technical guidance and laboratory support, CARPHA helped us navigate the storm. It gave us the tools to act, not react. It gave us science when fear threatened to take hold of us. It gave us the tools to act swiftly, and it gave us hope when hope was in short supply. Colleagues, this new strategic plan builds on those hard-earned lessons. It recognizes that public health is no longer confined to hospitals and clinics. It is about climate change. It is about food security. It is about mental health. It is about digital transformation and the social determinants that shape our lives long before we ever see a doctor. The plan outlines 5 strategic priority areas, each one a building block for a healthier, more resilient Caribbean. It calls for stronger surveillance systems, smarter investments in health infrastructure, and deeper integration of climate resilience into our public health planning. It challenges us to think beyond our borders, beyond our sectors, and beyond the status quo. But let me say this plainly. No country can do this alone. The challenges we face, whether a pandemic, whether it's a hurricane or rising non-communicable diseases, do not respect national boundaries. And that is why CARPHA exists. That is why this plan matters so much. It is a roadmap for collective action, a framework for shared responsibility, and a reminder that when we act together, we are stronger, smarter, and more secure. And as a son of the Caribbean, I feel this work deeply. I see the faces of our people in every policy that we craft. I hear the voices of our nurses, our doctors, our farmers, our young people, all calling not just for protection, but they're also calling for progress, deliberate progress. And I believe with every fiber of my being that this plan brings us closer to the Caribbean we all deserve. So let us move forward with purpose. Let us lead with courage. And let us never forget that the health of our people is the wealth of our nation and our region. Together, through CARPHA, we are not just responding to crises, we are building a future where every Caribbean citizen can thrive. So, ladies and gentlemen, I want to commend you on this very important occasion where we launch our strategic plan 2025 to 2030. As we continue this process, I want to encourage us to use these moments to think strategically as we seek to preserve the region that we love so much. Thank you, and may this new chapter be one of bold action, deep collaboration, and lasting impact on our region. Thank you, and God bless you all.
Thank you very much, Honorable Minister, for those excellent remarks, and thank you again for your continued support. You know, Minister is always ready whenever we need anything of him, whether it's remarks or advocacy, always there on our side. So we really appreciate that, Minister. And speaking of persons who are always on our side, it's my pleasure to invite Dr. Armstrong Alexis, the Deputy Secretary General of the CARICOM Secretariat, to give us the keynote address. Over to you. DSG, please welcome him.
Thank you very much, Mr. Master of Ceremonies. I'm sure you will agree with me that the protocol has been firmly established, so I shall not go through the very long list of colleagues, friends, partners who are here with us. But having said so, I would like to particularly say a pleasant good morning to the chair of the CARPHA board, Honorable Minister Philip Telesford, Minister of Health of Grenada, and chair of the board, Dr. Nisa Inda, the executive director of CARPHA, my colleague Alison Drayton, the Assistant Secretary General for Human and Social Development, all the chief medical officers, permanent secretaries, other colleagues from CARICOM, representatives of the international development partners that are here with us today, ladies and gentlemen. A pleasant good morning to you all. It is an honor and my distinct pleasure to be addressing you as your keynote speaker at this significant launch of the CARPHA 2025-2030 strategic plan. This, for me, is very significant as it comes in the backdrop of recent changes in the global economic landscape that necessitates a paradigm shift in the setting of priorities and ensuring that our institutions in the Caribbean better position themselves to address the growing needs of our region and its people. I am particularly pleased to be addressing you this morning because over the past 10 months, I have engaged CARPHA and officials in public health in the Caribbean in a number of settings, ensuring through it all that the importance that the role of CARPHA plays as a CARICOM premier public health institution is both recognized and secured. Today's launch comes only a week after the Secretary General of the Caribbean Community signed a joint sub-regional cooperation strategy with PAHO. CARPHA was intimately involved in crafting this strategy and will be integral in its implementation. The timelines and relevance of this launch is therefore underscored as a pivotal and strategic landmark that signals the continuation of thoughtful and deliberate interventions to benefit the region and secure public health gains that, if not reinforced, run the risk of loss of or reversals in previously achieved results. My presence here this morning is also an indication of the commitment of the CARICOM Secretariat to walk the journey of hope and optimism with you, to navigate the tides of uncertainty with you, And it's also our pledge as the CARICOM Secretariat to accompany you, advocate for you, and join you in designing a future that affords our citizens a public health architecture that meets their needs, protects their interests, and secures their right to live in a healthy Caribbean region. Ladies and gentlemen, we gather at a time when strategic clarity, alignment, and implementation are not optional. On the contrary, they are essential ingredients for success. As I alluded earlier, the current shifts in the multilateral system compels us to be more strategic in our planning, more deliberate in our design, and more focused in our approaches to secure results for our people. The global context in which the Caribbean must now operate is marked by overlapping crises, economic uncertainty, climate volatility, increased disease threats, and persistent structural changes and challenges. These are complex issues, but they are not new to us, and while they evolve, we must also, as institutions, find the appropriate responses. It is therefore timely and commendable that CARPHA has laid out a plan that is both responsive and forward-looking. Importantly, CARPHA's Strategic Plan 2025-2030 does not exist in isolation. It complements and supports the broader health goals of the CARICOM Secretariat Strategic Plan 2022-2030. There are several areas where this alignment is evident. Both plans emphasize the urgent need to build resilient health systems capable of responding to public health threats. The Secretariat's work through the Caribbean Cooperation in Health Framework and the Caribbean Regional Strategic Framework for HIV and AIDS is strengthened by CARPHA's technical expertise in this area. The fight against NCDs remains central to the regional health agenda. CARPHA continues to provide technical leadership to the several policy mandates of the community, and in keeping with the heads of government adoption of a results-based management framework for the Caribbean and for the community, your board, the CARPHA board, has directed CARPHA to anchor its operations in the principles of results-based management, and that is commendable. It is my view that based on the value of the support you provide to the community, the dedication of your team, and the indispensable nature of your work, that CARPHA is a high-performing organization. I am aware that there are challenges, but despite the bumps along the way, you have been able to withstand those forces that threaten to derail you, and you have persevered. Your achievement for the ending period is irrefutable, and your pathway to 2030 is well articulated in this plan that is being launched this morning. I can only therefore wish you every success and remind you that the CARICOM Secretariat is here to support you as you undertake your role as the community's premier public health institution. It is also commendable that the leadership of CARPHA has so strategically positioned the organization to ensure that the gains of the previous period will continue into the next. And I want to pay particular congratulations to Dr. Inda. I'm not sure, Dr. Inda, if I should still refer to you as the new executive director, but in your role, I wish to commend you for the tremendous work that you have done and the partnership that you have built over the past few months. CARPHA and the CARICOM Secretariat have collaborated on several fronts in providing support to member states, particularly in scaling up prevention efforts, strengthening surveillance, and improving access to care. A thorough review of the CARICOM 2030 Strategic Plan and CARPHA's plans acknowledge the growing need for integrated mental health and psychosocial support. This is especially relevant in the post-disaster and post-pandemic context, and evidence from post-burial, post-COVID-19, and post-volcanic eruption in St. Vincent and the Grenadines indicate clearly that trauma and recovery intersect with development. Finally, even as the Secretariat advances its work in climate resilience, it is imperative that CARPHA's health environment nexus be supported, whether through vector control, food and water safety, or health emergency preparedness. The CARICOM Secretariat sees this strategic plan as an opportunity to strengthen structured collaboration between the Secretariat, CARPHA, and other regional entities, and a roadmap to guide how member states align their priorities and collaborate on critical regional imperatives. Ladies and gentlemen, this will no doubt require coordinated approaches to resource mobilization, clear implementation roles across the health landscape, and joint reporting on progress on regional development outcomes. We must reduce duplication, increase interoperability, and focus on results that matter to the people of this community. Distinguished ladies and gentlemen, strategic plans are only as good as the results obtained from their implementation. The CARICOM Secretariat welcomes the strong alignment between the two plans, but alignment is just the beginning. What we now need is to deliberate on coordination between regional institutions, particularly in terms of implementation in member states, resource mobilization, and progress monitoring. A key component of the successful implementation of this strategic plan will be robust monitoring and evaluation, allowing us to track progress, assess impact, and make timely adjustments. Capacity building within member states must also remain a priority. By investing in the training and development of healthcare professionals, we strengthen the foundation of our regional health systems. In parallel, we must continue to advocate for evidence-based health policies and facilitate the sharing of best practices across our member states. These actions, taken together, will not only enhance delivery, but will also reinforce our collective commitment to improving public health outcomes, strengthening resilience, and promoting long-term sustainability in the Caribbean. I take this occasion to commend CARPHA on its achievements over the past 5 years. One which stands out for me is being successful in bidding for the pandemic fund and also, most recently, securing grants for the support of the AMR-led projects of the member states and beneficiaries. Ladies and gentlemen, these were not only timely, they were also invaluable. Let us applaud these tremendous achievements and recommit ourselves to doing even more to ensure purposeful benefits are derived from the outstanding work that is done every day by our public health professionals. The CARICOM Secretariat remains committed to supporting CARPHA and urges member states to continue the dialogue on advancing health. Distinguished ladies and gentlemen, if there were ever a time for collaboration, it is now. Henry Ford reminds us that coming together is a beginning, keeping together is progress, and working together is success. We must continue to convene, coordinate, and advocate at the national, regional, and international levels to ensure that health remains a pillar of resilience and a driver of development. As we move forward, let us be specific about where collaboration can be deepened for real impact on the region's human development and sustainability. There are already mechanisms in place such as the Caribbean Cooperation in Health Framework, the interagency and member state-led technical working groups, the Regional Health Communication Network, regional core coordination groups, and other activities led by other partners. Let us build on these and ensure that implementation is not fragmented, but integrated and efficient. In closing, I applaud CARPHA once again on the development of this strategic document, which highlights a review of the achievements, challenges, and the recommendations to not only mitigate current threats, but to be strategically positioned to address future and re-emerging threats. Ladies and gentlemen, this is a significant milestone that is to be celebrated. The CARICOM Secretariat reaffirms its support as we transition from planning to implementation. In closing, I wish you a successful launch, purposeful deliberations, and succinct outputs for today's engagement. I look forward to implementation on priority areas, and in time to come, we should be able to gather again to review outcomes and celebrate success. I thank you.
Excellent. Thank you very much, DSG. And as DSG mentioned, plans are only as good as the results, all right? That's why you would see as we go through the next 2 days, we will speak a lot about results-based management because we're not just doing work, we're also measuring the impact of that work. And thank you, DSG, again for stressing the commitment of the CARICOM Secretariat to support and advocate on our behalf. All right, so we've reached the part now, you might be wondering, what are they covering with that white thing there? Or if you're not, there's a white thing being covering something there. What? So we're gonna move to the part where we're gonna unveil the cover of the strategic plan, and of course, that plan is in the link to the folder that we would have sent on about 3 occasions to your email addresses, and we're gonna send again shortly. So I'm gonna invite the DSG and Dr. Indar to stand on both sides and unveil the design for us. And then we're going to invite Dr. Cox and ASG as well to take a photo on the sides. And after that, we're going to have a photo opportunity with everybody outside. And I'll ask Miss Carolyn Curtin, the lady with the blue that's ducking around, to provide directions for that. Thank you. All right, Isaiah. Lisa. Hi. We were to have a drum to do a drum roll, but the drum got caught in the rain, so we'll just do an unveiling. All right. All right, so we'll invite Dr. Cox as well, and then ASG to take a picture with the plan as well. All right, so we'd like to invite persons to go outside the doors on my right for a photo opportunity with all of the participants. Thank you. Carlon, please, or Isaiah, please give instructions to persons when they go out. Thank you.